back to back.
We can hear you. Can you hear us?
Oh, I'm sorry.
Can you hear us now?
Oh, I can hear you.
Okay, yeah, because we could hear you.
I'm sorry. Let me mute.
No, don't, it was fine. It was totally fine. No, you don't have to mute. Welcome, welcome, welcome.
Oh, okay. Glad to be here. How you guys been?
Really good.
Okay. I know the pandemic, but everybody's been safe.
I got my booster shot yesterday and I'm feeling it today.
Oh, okay.
Hi, Catrice. Hi, Helen. Hi, Sophia.
Gotta take it out.
You all, consumers is just cutting down trees here in Flint. It's like outrageous right now. And I can't believe they're on top of it like they are. So it's just shocking. Okay, but a lot of wind happened, I guess.
Oh yeah, yeah. I've experienced the same. They're doing a lot of tree cutting and alley clearing out too.
I mean, normally it takes them a minute to come do that around here. So
Well, you know, a lot of power outages.
yeah, luckily I don't. So keep your fingers crossed.
There you go.
Which makes me remember to make some other people some hosts here because
At La Sed here, we keep getting our in and out.
do ya?
Yeah. So if I cut out, I'm sorry, it's a win.
Understood. Glad you're here. Okay, well, we'll get started. Did I make you? I made you the co-host, didn't I, Vanessa, as well as?
Yep.
Okay, awesome. Thanks so much for joining us. Thank you, thank you, thank you. As we round into the holiday time when most people have some time off. So I appreciate you making the time to participate in this subcommittee. My name is Philip Barnhart. I use he, him pronouns. I am a health equity consultant at the Michigan Public Health Institute, and the Michigan Public Health Institute, also known as MPHI, is in partnership with DAAA, the Detroit Area Agency on Aging, and AARP to create something called the Inclusive Healthcare Taskforce. You all are familiar with this, and you are so generous to give us your time and ideas and knowledge on community. So with that, I'm gonna ask us all to introduce ourselves, starting, if we don't mind, with the team from MPHI, and then followed by DAAA, and then everyone else into the space.
Hi, everybody. My name is Vanessa Burnett. My pronouns are she and they. I'm also a health equity consultant with Philip over at the Center for Health Equity Practice, and I will be scribing for us today. So my voice won't be in the space, but I'll be here with you, just documenting what y'all talk about.
And I think our evaluator Jaya stepped away. So when she returns, she can introduce herself, and maybe we want to pass it over to Anne and Krishara.
You're on mute, Anne.
I'm sorry. I'm Ann Holmes Davis. I'm Vice President of Planning and Program Development at the Detroit Area Agency on Aging. I'd like to welcome everyone to the table. I'm co-lead with Philip on the Inclusive Healthcare Task Force.
Good afternoon. I'm Krishara Allen from the Detroit Area Agency on Aging. I'm an associate planner. Welcome everyone, and I look forward to hearing this wonderful discussion that I know is to come today. Helen?
I'm I'm Helen Love, and I'm on the communications team at the Detroit Area Agency on Aging, and happen to be aging in Detroit all of my 75 years, and a particular interest in this and supporting this particular committee.
Okay, well, I guess I'll go. Eddie Powell, Deputy Director over at St. Patrick Senior Center, along with our Executive Director, Satrice Coleman Betts. And as like everybody here, we're here to listen in and give input and feedback on this terrific and wonderful, presentation here. So we're all here.
Hi, I'll go next. I'm Mary Carmen Munoz, Executive Director of LACED in Southwest Detroit. Truly appreciate you including us on this very important conversation. So we're very excited to be joining you today. Thank you.
Hi, good afternoon. I'm Christy King, Association Executive for the Southeast Michigan Senior Regional Collaborative. So excited to be part of this task force.
Good afternoon. My name is Ana Rosa. I am a coordinator of senior services at LACED Senior Wellness Center, and I'm also happy to be joining everyone today.
Hi, I'm Winona Bynum. I'm the Executive Director of the Detroit Food Policy Council, and I'm happy to be included also.
Hi, Melissa. Oh, sorry, go ahead.
Go ahead.
Oh. I'm Melissa John, Director of Social Work at Hannon Center, and happy to be here.
I'm Sophia. I'm a first-year medical student at Wayne State University School of Medicine, and I'm excited to be part of this task force.
My name is Satrice Coleman Betts. I'm Executive Director at St. Patrick Senior Center, and I'm just actually excited and curious about which ways the initiative is going to go and learning more about the subject.
Did we get everybody? Melissa, did you introduce yourself?
Yes, Hannon Center, Director of Social Work.
Sorry, okay, I got distracted. I know Sudha just came into the space. I'm not sure if Sheila introduced herself either, but if you did, I'm sorry, Sheila.
She's not able to speak. where she
Okay,
is.
okay, go, I see that. Sudha, are you there?
Yeah, hi. Hi, I'm Sudha. Sorry for the delayed join. I had something else to be on. But yeah, I'm a family therapist and also an evaluation specialist. I work with community organizations on program development. And I've worked with DAAA before, which is why I'm here, I think. Anyway, looking forward to working with this team and contributing.
All right, has everyone been able to introduce themselves if they want to? Fantastic. Okay, thank you so much for being here. I want to just, oh, hi Sheila. Are you there?
Just muted herself.
Okay. I want to just remind us of the 3 tasks that we have in front of us as described by the project. We are here and tasked to develop strategies and recommendations to improve access to mental health and other needed services for those at risk. We are tasked to recommend strategies to community diversity, equity, and inclusion, as well as social justice. And we are tasked to better coordinate family and kinship support services throughout the lifespan, including using technology, social media, and other state-of-the-art strategies supported by interaction and technology. We're all serving on this subcommittee because we have an interest and expertise in social and community contexts, which is the social determinant of health domain that we're focusing on. And so I want to anchor us for one moment, and I want you to follow me in thinking about a Detroit in which folks aging in Detroit can expect to live just as long as folks aging in the rest of Michigan. What does that Detroit look like as far as social and community context? What does that look like so that everyone has an equal chance to have a long, happy, healthy life in and out of the city of Detroit, but particularly our aging folks in the city of Detroit? So focus on that and then speak it out into the space, and let's just start the discussion. Vanessa will be scribing and I'll be helping her scribe.
I think one of the things for me that comes to mind is access to safe and secure housing. And so, and even in thinking of safe and secure housing, I'm thinking about not just seniors that may go into housing development, but I'm thinking about how do we secure, what does it look like for seniors to be safe and secure in their homes that they've been in for 30 and 40 years? And with that, making sure those homes are safe for them to reside in. And how do we support those neighborhoods to make sure those neighborhoods remain safe as well for them to reside in?
I love that. Let's press into that a little bit, Christy. Let's talk about what does safety mean and what does security mean?
So for me, some of the things I think about is, and maybe I'll speak a little bit in examples, is that you may have a senior that's in a home that may need a roof, that may need some plumbing, that is in desperate. I'm just thinking of a call I received a couple of weeks ago, and the senior's been in this home 40 or plus years, and the home is in desperate need of repair, and the family is limited in their ability to help. So how do we make sure that that senior remains safe and that the family has what they need to make sure that their loved one stays safe? How do we begin to work with policing efforts and things like that to make sure the neighborhoods are, maybe some of our older neighborhoods where our seniors reside are safe? So it's more than just that individual, is really about the system itself. How do we begin to impact the system? I'm just kind of seeing seniors and just kind of in spaces that they may be secure in their homes, but they're not really secure in their homes. They have somewhere to be, but are they really secure? I don't know if that answers your question, Philip.
Oh, for sure it does. Absolutely. I'm thinking about this wind that I was just complaining about a minute ago, right?
Absolutely.
I mean, what happens if you have no money, right? And a tree falls on the back of your house, and you can still, and it doesn't mess up your electricity. You can still live there, but now you have a tree in the roof on the back porch. What's up? I mean, that is not safe. That's not safe.
Yeah.
Go ahead, Mary Carmen.
I agree 100% with what was just brought up. Many of our seniors do live in their own homes and have been living there for decades. As they get older and are unable to maintain their homes, small maintenance issues get larger and larger. The roof is one of the biggest issues. Roofs, you have old boilers, not just furnaces, but boilers that need attention to, hot water tanks, electrical issues, small things, doorknobs, light switches, light covers. It just, the list goes on and on. But in addition to having a functional, safe and secure home itself, you have the issue of those people living in those homes, as I said, for decades, and the block has changed. You have crime as a big issue with gangs, and they're afraid to say anything because because of the retribution from the gang members. That is a big issue in our community, are the gangs and the seniors being afraid of them. I don't know how to begin to stress that. And we've made multiple calls. It's not like we're not letting the police know. It's just an overwhelming issue. How is that taken into account? How do we make our seniors feel safe in the neighborhood, to be able to walk to the grocery store again, and not be afraid of being roughed up by one of the gang members? Another issue is the homeless issue in Southwest Detroit, homeless / mental health issues of the homeless. It's a growing concern because of the development that's taken place in Cass Corridor, in the area where many of those homeless had homes or had shelter. They're moving to Southwest Detroit. How do we assist our community with mental health issues that other larger organizations have brought into our community by giving the homeless and the addicted housing, providing housing, and then when they're no longer paying rent, or they're evicting them, and then they stay in the community. It's a problem that is not being addressed. So those are some of the 3 issues that we see over here. Ana Rosa, I don't know if you have anything else to add to that, but that's, the things that also property taxes are an issue, and people don't know how to get the assistance with, even though we're here and help them fill out the forms. Property taxes are increasing, and it is a growing problem in our community. Ana Rosa, did you have anything else to add to that?
Regarding housing, I did want to add that so many seniors, of course, for the initial housing applications and then for redeterminations or like recertifying, they need assistance. And some of the complexes are so strict with those applications, they don't assist. So of course they come to us, which we're happy to help, but it is very time consuming to keep up with all of those different aspects. And like Mary Carmen was saying, they all kind of funnel down into us helping with so many different aspects of it, which really does overwhelm, our staff as well. So I think it's very challenging when everything, instead of potentially having somebody at the center that could help them, like the housing complex that could help them, it tends to come to us.
So what I'm hearing is that safety is a twofold issue, right? So we're looking at safety from the actual physical condition of where one is living, and also safety from the external conditions, like what we would normally consider crime or trouble with other people rather than trouble with the house that you live in. So in a perfect Detroit, not perfect Detroit, but in a Detroit where folks could expect to live as long as somebody in some other location outside of Detroit, folks would be able to live in secure houses that aren't dilapidated, aren't in need of repair. The police or the social fabric of the neighborhoods would be so that people could walk without fearing for their safety to the grocery store or to wherever they needed to walk to. From Ana Rosa and Mary Carmen's points, there would be community, maybe family or extended community, who would help folks if they needed to fill out paperwork or needed to get services. You wouldn't have to go to an agency to get those services. Sheila says, for seniors living in homes, many times they are alone or isolated. In suburban communities, there are senior centers where they can go to socialize and do things they enjoy. I would love to see senior community centers for senior daycare for socializing and a sense of belonging. So in our vibrant Detroit, we have every neighborhood as it still exists in Detroit has a vibrant senior center that's safe. Mary Carmen is asking, what is the average age for seniors in Detroit versus suburbs? I don't know if somebody on the call knows that.
I think that varies, but we have some stats where if just look at in terms of longevity, we have one stat where we found that a senior in Midtown lives 13 years less than someone in the Grosse Pointe area. So, the longevity is not as long in the city of Detroit on average than in some of the other communities, even within our region.
And that is that statistic is a constant over a 30-year period, correct?
Right. At
Go
least
ahead.
in the last 20 for sure.
Go ahead, Mary Carmen.
I'm wondering the quality of healthcare. Obviously, I think it plays an important role in that longevity issue. The fact that our seniors might not be getting this, they might be seeing a physician just as frequently as maybe someone in the suburbs. However, what is the quality of that care versus the quality of the care of the senior in the suburbs? I wonder if that plays into it. And how do you measure that quality of care within the city of Detroit, within our lower income neighborhoods versus the quality of care in the more affluent neighborhoods such as Grosse Pointe or further out west or north? I don't know how do we find out, or how do we change that? I guess I'm not sure how to address that.
Well, I think that part of the quality of care is just having sufficient health professionals that are accessible and nearby. Oftentimes, older adults may have to go further out to access their physician, which means that there's a transportation barrier often, and sometimes they have difficulty getting across 8 Mile to gain that access to that care. So it's how not only where the quality is, but how accessible is that that care. That's an issue. With the transportation barriers and not having sufficient number of physicians or healthcare professionals.
And I think in other groups in this project, we've talked about maybe making healthcare accessible at a more local level, in the sense of bringing healthcare providers to community centers if they exist, or into neighborhoods, so folks don't have to travel to other locations. And I'm not sure where they would travel to. I guess when you're talking about an 8 Mile divide, and does that mean folks are having to seek healthcare either downtown at the hospital or in locations outside of the city limits? Is that what we're talking about?
Right. Sometimes they have to go further out to see their physicians. Yeah.
What are some other, I'm just going to put some stuff out there because we are going to get to the challenges, trust me. But I just want to focus and anchor us on what a healthy Detroit looks like, right? And for me, that means seniors can expect, or the aging population can expect, to have access to healthy food and choices. They can afford that food. They can, if they are needing help with cooking it, they can have access to that. They can have access to nature. They can, I think, really importantly, not feel isolated. If they want to hang out with friends, there are friends to hang out with. If they want to learn new things, there are things to learn and access to learning those things. What else, folks? What's a great Detroit look like where people are just healthy?
So one of the things I picked up on reading the articles you sent, Phil, is that a lot of them talked about not just access, but usage as well. And I think sometimes, of course, you're thinking access, but then you're thinking people have to understand what the benefit is to using whatever it is, technology or whatever service, so that they actually are like motivated to use whatever they have access to, because I think both go hand in hand, right?
Mhm.
So powerful, Anna Rosa. Thank you for bringing that up. And you know that so we're going to have some reading for y'all later if you want. But Anna Rosa is referring to something called the third level of the digital divide. And that third level of the digital divide means this. The first level is, do you have the technology? And if you can answer yes to that, then you've crossed the first level. Do you have a cell phone? Do you have internet service? The second level is, can you use it? Do you know how to use it? You know, and for most people who have technology, if they've crossed that first divide, there's some place in the second divide. It's like, yeah, I can use it. Do I use it? I don't know. Or maybe I can't really use it, but I say I can use it. I don't really know. You know, like I've shared before, my mom and dad got a computer like 25 years ago. My mom disconnected the internet 20 years ago because she didn't trust it. They still have a computer. They use it every day. They play solitaire on it. That is what they do on their computer. Right. And they love it. Right. So, and I've explained the internet, you know, and my mom's like, no, I don't get it. Don't trust it. Doesn't sound right to me. What Anna Rosa is referring to is this third digital divide. And that means that actually, if you are using your technology and you know how to use your technology, this opens up access to so many things that we don't realize, because most of us have crossed that third digital divide. Most of us on this call know how to check their bank account and would be okay checking their bank balance online, would be okay having a telehealth appointment online, are certainly okay going into the Zoom meeting to do work. Many of us are working from home, which is, you know, think about the people that don't know technology well enough to even get the type of job where they can work from home. And so during COVID, have to be frontline workers and paid less and exposed to the, you know, so the more you are able to use the technology, the richer your life can potentially be, just because that's the place that we live now. So and it's kind of hard to get your head around. So I really appreciate you bringing that in, Ana Rosa, because especially when we talk about senior learning, right? Seniors, I love learning. You would probably love to learn something, but if you're intimidated by your computer, then the chance of you learning a new skill via the computer is somewhat limited. I'll stop talking now because, you know, I can talk and talk. Helen, I see a hand. Oh, Helen, I accidentally muted you instead of me. I'm sorry. Can you unmute yourself?
I did, I think. Can you hear me? That's the important thing. So related in terms of the digital divide, I really believe in education for a lifetime. And that even goes to prenatal care, but for sure preschool throughout the lifespan, and to think about what it means to grow up and grow older at the same time, to make lifelong learning as integrated into the public school system as anything else would be, so that older adults can be seen in those settings, and it's nice to see them there. And then there's a focus on what we all need to learn as we grow older, whether it's taking care of the houses that we have with access to simple home repairs, or expanding our own education and knowledge, and perhaps for new careers, encore careers for a number of people.
Definitely needed.
Okay, now so we've captured some beautiful Detroit, perfect Detroit space. Now we're gonna push and we're gonna move on that energy, and we're going to go into what's called a SWOT analysis or a SWOC analysis. You're all probably somewhat familiar with that. It just means strength, weaknesses, opportunities, challenges. And because we've come off this envisioning, we're going to move into strengths. What are some things happening in the city of Detroit in community and society contexts that are awesome, right? That helps everyone, helping seniors right now today. What do we have going on?
Well,
We have DAAA, which we could not have gone through the past 2 years without the support of DAAA for our seniors specifically. LaSed has a large scope of work, and the senior program is a big part of our programs here at LaSed. But if it was Detroit, DAAA is a gem within the city of Detroit that is, we could not have made it through without them. And also the ability to partner with other senior centers, that DAAA brings that connectivity to us. I'm telling you, I cannot tell you how many times I reached out to Satrice personally, and she's kind enough to give me her cell phone number. She knows if I call, it's like, what does this girl want now? But, you know, it seems like we were the Lone Rangers within the city during a pandemic this country, the world hasn't seen in century, right? So I just want to appreciate right now DAAA and your people. We could not have done it without you. I know that you guys.
Likewise.
I mean, you're
with all the partners.
you're the little things, like those little care packages that you put together, and they would put these care packages together for us. I don't know if you're familiar with it, Phil. During the middle of COVID, during the worst times, these beautiful care packages packed in white boxes with beautiful yellow ribbons that we would drop off to seniors' homes on their porches, and that made such a difference. That is something good and profound that happened in the middle of the city of Detroit. So other than that, it's hard for me to say. I'm telling you, I'm not. Right now, the seniors, we're having city of Detroit and has more red tape than I don't know what. So thank you, DAAA, for all you've done. Thank you so much. And I love you, Helen. Hi.
Eddie, what's up?
Well, I like to say to piggyback on that, but the food services part of it, to feed a lot of seniors who are not having so much, they're limited in funds and they don't have much. So we've been doing a lot of stuff with the food services stuff and providing great meals and lunch boxes and all these kind of things. It's been great, and they responded to that real well. So that's one of the great things I see that's happening in Detroit, with a lot of food being delivered and serviced to the people. So
that's awesome. Eddie, are you talking, what's the, here it's the Food Bank of Eastern Michigan. Isn't it is it Gleaners down in Detroit? Is that the food bank?
Well, you got Gleaners, and then you have Forgotten Harvest. It's about 3 or 4 good ones, and they've been doing a good job. Then we've been partnering with other people that's been giving us food boxes to deliver to the people. So it's been a lot of support that way with the food. So that's one of the great programs that I see that's been going on. That's pretty good.
Wonderful. What else?
Once again, those are private nonprofits. Those are outside of the city of Detroit. If you're talking about the city of Detroit needs to expand those resources and or expand their funding of these gems that kept us going through the COVID with the food. I mean, DAAA provided grocery shopping for just from LaSed, 25 seniors every month that we would rotate, in addition to working with Focus Hope on providing food boxes and Gleaners with providing food boxes and Forgotten Harvest. It's so we need to, I think we need to work on the city itself to expand funding and or probably not expand their services, because there's so much red tape, they would screw it up. give more funding to the organizations that focus on those services to the seniors. I don't know. I won't talk anymore, I promise.
Oh, no, this is great. I want to say that Vanessa says that University of Detroit Mercy has a food bank as well, and that they deliver into the community. So I just want to lift up when the going gets tough, at least we are seeing some people step up with making sure people aren't hungry or starving. For sure, Mary Carmen, we have talked about this in every single session. The city infrastructure and superstructure is really problematic, right? That, in the last group, we were talking about how the city planning doesn't even plan for an aging population. An aging population is kept out of the city planning altogether. Winona, I see your hand.
I'm sorry. So I hear like a lot of nonprofit organizations, be they food banks or pantries, are really helpful. But I was wondering, so, and working on the ground with food somewhat, or working with partners who are working on the ground, one of the things that I saw with seniors was the lack of fresh food when it was an emergency. So we had the food boxes, but we didn't have as many people working, getting fresh food. One of the workarounds with that, again, it wasn't the city, but it was nonprofits or for-profit organizations even, our urban farmers in the city. Quite a few of them had CSA boxes, some of them discounted. I know of one urban farm that delivered to seniors specifically fresh vegetables because the boxes that were provided by especially gleaners, because they had to step up and get so much with less people, they went to shelf stable. And as you know, shelf stable, a lot of times it fills you, you're not hungry, but it doesn't support health. So I would love, I'm excited about this, but I would love to see us get to our seniors where they are, like, their needs are met, but some of their wants, and that we are really supporting their health, because a lot of our programs are making sure people maintain but not able to meet all of their wants. If that makes sense.
Oh, it makes complete sense. So many studies about food systems show that without choice, it's just another type of oppression, right? Yeah, we're sustaining you from not dying, but we're not increasing the quality of your life necessarily because we're not allowing for choice. Couple more strengths before we switch over into the more difficult aspects. What about the money that's coming into the city or the country itself?
I think that I know that that it's out there, but trying to obtain funding as a small nonprofit is once again, I think the red tape needs to be, it needs to be an easier process for the nonprofits to obtain those fundings and get it back to the seniors or to the community that needs the assistance most. The funding is there, and I kind of chuckled when you asked that question, because yesterday the state is receiving tremendous amount of funding, and they designated $160 million for for something that's I forget, please forgive me, but it just they're not focusing on the communities that need the funding. They're not focusing the monies where it should be. They're focusing on PR or I don't know. It's just very frustrating. So the funding is there, yes, but how can we obtain it easy in a more easy process.
Citrese, how do you find is St. Patrick's getting what they need, and is that a strength? Give us a good example of something working.
Okay, a good example of something working was through partnerships, say with DAAA or with the city of Detroit. We were able to access quite a bit of the CARES Act money to provide services, and then working with our partners to help expand our service areas. So I think the relationship part and the community support aspect of Detroit, and especially with the wellness partners, is pretty good. Quite a few of us have been in our positions for a while, so we developed these relationships where we know each other and we know what we need, and then we communicate well. That's something good.
Man, that is such a great thing to say, right? Because what just hit me was how resilient, that word resilience, terrible for me in Flint, because that's what we talk about, resilience, right? Heart, like the people in Detroit, like the people in Flint, are tough. I mean, we're tough. We've just been here, we've lived through it. And those of us who work in social services know one another. We have enormous hearts. We know how to get things done on a shoestring. And I think that is a huge strength, right? And it speaks to Mary Carmen. I hear what you're saying, that there should be an easier way, right, to access, to cut through all of the bureaucracy. And so I want us to lean into this strength that we all have, that we can even show up in a space like this and say, hey, we're going to make a task force. This is going to work. We see what the problem is, and we're going to figure out a way to do it, because each of us have our own special talents or special access to things, and coming together, we can solve this problem. I think that's a strength.
You know what, Philip? Another strength, I was just thinking, when you were saying heart, they use the term grit. I think all of us are really hardworking. I remember during the pandemic, Mayor Carmen was driving boxes around and delivering stuff. Ann is emailing at 2:00 in the morning. Helen is calling me on Sunday. So we're all like work whatever hours we need to, and getting dirty and doing all kinds of stuff that we didn't go to school to do. Just to make sure that our programs work and that the people are getting served.
Yes, I see Winona and then Mary Carmen.
So one of the strengths I would say so in the city of Detroit, in the planning department, there actually is a food task force. I think we need to learn how to tap in and connect with them better. At the Food Policy Council, we do have somewhat of a relationship, but we could definitely strengthen it. So there are people in the city thinking about this. I just think sometimes there's a disconnect, and we'll probably talk about that more, but there are, and you all have a Food Policy Council, so that is one of the things that we completely concentrated on is food, which is why DAAA connected with us, because we have a relationship with a lot of our legislators working on that. And again, that could be deepened and strengthened. And it takes you all to help me do that, because it's really a community-led organization. So
I think that I also would like to talk a bit about the City of Detroit Health Department have been incredible. Once you establish that relationship with them, they have been incredible to work with. We kept knocking on the door pertaining to vaccines and bringing them pop-up clinics here to LaSed to bridge that language and cultural divide, to get more of our community vaccinated back in February. And we were able to develop a great relationship with the City of Detroit Health Department. I think that health department is a gem that needs to be cultivated a little bit more beyond COVID, beyond just the vaccination push, because you've got some nurses and doctors that are committed to our communities and to the city. So maybe after we should begin now the process of developing what other assets they could bring to our community. They were phenomenal to work with, absolutely wonderful, committed, hardworking doctors and nurses. It is a pleasure to continue working with them. We have provided over, working in conjunction with them, over 3,500 vaccinations at LaSed through our vaccination pop-ups. So, and they are just great. I'd like to be able to expand those services using the city resources. That would be great.
Can I piggyback on her right quick? I'm sorry, I'm talking a lot. But the Food Policy Council, we actually have a representative from the health department that sits on the council, and we have found them to be really great partners. We also have members from the mayor's office and city council that sit on our council, and they attend our meetings. So that if it's a food related thing, that's really cool to talk through that with them. Our meetings are open. So like I said, I love your help in knowing these issues and deepening that, but we do have relationships with all those city bodies.
I think in terms of social and community context, there are a lot of wonderful community assets, amenities that exist within the city that we should take more advantage of. Of course, COVID-19 has made it difficult, but Detroit is a jewel, and they have a lot of wonderful resources that need to be tapped into further.
Yeah, I always think about that too, Anne, when I think about Flint, right? Both Flint and Detroit grew up at a time when there was just so much money from the automobile industry that we have these things like these art museums that are like world-class, symphony orchestras, things that we just really couldn't do today, right? That, well, maybe, I don't know, I guess we build big stadiums downtown now too, but that's another discussion. But yeah, that's a richness in community, right? Maybe travel groups, groups getting together and doing those things, right? COVID has stopped that, but I mean, Belle Isle, what's going on at Belle Isle is just incredible. So let's switch over to weaknesses. So we talked about strengths. And we got some great stuff going on. I think what I heard, which I think is really beautiful, the thing that stands out when we talk about community, we are community. In this call, we are a community, and we are willing to help one another and leverage our time, treasure, and talent to push into this project. And I'm going to argue that that would be the same if it were a different project. So our tenacity and our community spirit are strengths. What are some weaknesses that are that hold the city back? Again, from assuring that aging Detroiters can live as long as other people. And yes, the diverse, Christy King says, Vanessa, that the diversity of Detroit is another strength. Incredibly diverse city, like incredibly diverse. So what are some weaknesses?
If I may speak, I feel like one thing that generally frustrates me in a lot of vulnerable communities is the piecemeal and short-term approach to everything. We have a problem now, let's pour in money for this. And then, okay, that problem is gone, now let's deal with the next one. And the other piece, of course, is this idea that, a community needs to work its back off to deserve a basic and good quality of life, something that we really shouldn't buy into even for a minute. So I think on on the level of the community, the government, the city, the municipal, the county, on a policy level, I think we need to unify our a few sets of principles for the next decade or 2 decades. One, for example, being that we're going to invest in self-sustaining solutions, creative and self-sustaining solutions emerging from the community. Just as climate change activists are pushing for renewable energies, we should be pushing for self-sustaining creative solutions emerging from the community that can last, that will grow themselves over time, and the community will keep improving as a result of that infrastructure. The second principle being this idea that we need to raise the standard of what a community deserves or should have on a fundamental level, not just, okay, everyone should, we should have more access to food banks. That's, great, but what about, community farms and constant and ongoing access to fresh vegetables and fruits? I mean, I think the way we approach it needs to shift, and it needs to shift on a policy level and then shift on a cultural level as well.
When we talk, that's really powerful. When we talk about that cultural level, should we talk about a weakness being how the folks who live in Detroit are viewed, whether that's through a lens of poverty or whether that's through a racialized lens? So I want to posit that racism is one of the weaknesses that we have to contend with in this discussion. Wynonna, did you raise your hand?
Yeah, so I agree with racism being at the root of a lot of our issues. I think the other thing is that being able to connect. So I'm hearing things that are actually going on in the city, and that like a lot of us are working on supporting like urban farms in the city and getting the city to support. There's a Black Farmers Fund right now that raised almost $100,000, or if it may be $100,000, that is at this time buying farmland in the city for urban farmers. And those urban farmers are then supporting their community by providing those fruits and vegetables, like I told you about the one urban farmer. But it's like getting the support for those long-term solutions are hard, because a lot of times we're so kept in crisis and that we don't even have time to talk to one another. So like even today, I was like, oh man, I got so much to do for the year end, to try to get things wrapped up. But these conversations are so important, which is, I'm glad that they're happening. But so the two things I think, not being able to connect, to lift up the things and support the things and break through that narrative that everything is going to be fixed by a food bank. Food banks are important because you got to feed people today, but you want to try to move people out of having to rely on those type of emergency situations. And I do agree that even more services, like, can we get past just feeding people and just really meeting our seniors' needs? Because I do think that is part of that gap. And when I talk to lawmakers, they or legislators, they want to support it and they don't know how. And I think groups like us, we can help them come up with some solutions that'll work on the ground. And I'm off of my soapbox now. Thanks.
Mary Carmen.
I feel like I'm talking too much. I think that I agree with what you said a little bit ago pertaining to the food banks. We need to focus on how to remove the need to go to the food banks. I mean, but that is when it comes to seniors, it's the limited income. How do we help them so that they don't have to rely on those food banks again? And I love the urban farming, the growing urban farms that we're finding, because it does provide them with fresh fruits and vegetables. And That's always great because they can go get them themselves. You don't have to go to a food bank and feel like you're a burden because you're at a food bank. I think another real important issue, and it goes back to diversity and racial equity, is the gentrification that we're seeing in the city of Detroit. The push for those, the push is there to get those younger workers to move into the city of Detroit, and where they're moving to Midtown, they're moving to the fancy condos over on Michigan Avenue in the former Tiger Stadium area that are $500,000 for a condo, a home down the street from us here in Southwest Detroit went for $290,000 because that young couple couldn't get into Corktown. So they bought in Southwest Detroit, but they're driving out the families that have deep roots here. It is a problem, and it is a racial issue. Those young people, I see them, this is the third young couple, non-minority, that has moved into that house in the past 8 years. And this young couple doesn't have any children yet, but the previous two couples started having kids, and guess what? They moved somewhere else to send them to a better school system, because we don't have that school system to support the kids. So you have the bookends of the community, right? You have the youth that need the foundation of a good education, and you have the seniors that need to have their needs met. And then you've got the families in between. Those bookends, they're holding up our society. I don't know, I guess I'm all over the place, but those are the weaknesses I see. The weaknesses that I see are the educational system that affects our youth, and then the support system that affects our senior citizens. And then gentrification rolls over, racial equity, diversity, and the need to make our communities more stable so they don't need to rely on the food banks for basic needs. They can pay their water bills, they can pay their utility bills.
There's definitely a need to figure out how we can redevelop the city without displacing the residents who have been here for many, many years and contributed in order to keep the city going. I know that they're trying to build a tax base, et cetera, but somehow there needs to be some kind of way to do it so there's not collateral damage to the residents, long-standing residents.
As you know, and we talked about various ways of integrating, right? I guess we could say integrating, but more like it really gets down to it. I really thought what you said, Sudo, is really powerful, right? It's about a mentality. It's about like Detroiters don't deserve any better, right? And I think that there's a buy-in to that. And at the city planning level, it's like when it was pointed out, why don't we plan for aging Detroiters, right? As a vibrant part of the community, as Brenda Price said earlier about AARP, seniors spend 60% of all the money in the United States, you know? So it's kind of like this ageism that is at the heart of it, you know, and it's coupled in our city with racism and with classism. So, you know, those are kind of theoretical statements. Anybody have feelings about that?
Some of those things are tied into the root causes that I think a couple of the folks have just noted as underlying issues.
Go ahead, Helen.
You're muted.
one of the things that concerns me, and growing up in the city, and we talk about diversity, we're still polarized. So we don't have integrated neighborhoods. And when we talk about planning for housing, with things that I've been involved with over my professional career, there have been strategic plans on the part of the city, but never have we seen any real outcomes of some of the most creative opportunities. So now with all of the space that we have, the vacant land that we have in the city, is a time to start looking at a different kind of neighborhood, intentional communities where you can in some X amount of, acreage, plan to have people live differently together, plan to have the communities where grandparents raising grandchildren have a place, but not where they're there exclusively. Because I think most folks want to be around, older folks want to be comfortable, but they don't want to be eliminated from access to seeing little kids growing up, so it's who in the city is really looking at what kind of change, things that are going around, not just around our country, but around the world that have been attacking some of these issues, to start bringing people together again. That's what's missing for me, is a vision on the part of our housing and planning folks.
That discussion came up earlier in our other committee meeting today.
Yeah.
The need, to have planned communities, and I love the term intentional planning.
Yeah.
Or intentional communities.
Me too. I'm all about this idea of an intentional community. That's where I want to live. That's where I'm going to retire. An intentional community. Yeah, and Winona says there are some integrated neighborhoods in the city, but not many. And I wanted to clarify, when I was talking about integration, I was talking about integrating older folks in among younger folks. But I think that the point is well taken, that for a city as diverse as Detroit is, it is fairly segregated as well. And that has real effect on the citizens. Yes, finding those intergenerational opportunities. Can we talk a little bit about and actually let's move into, do you want to move into opportunities or challenges? No, let's move into challenges, okay? So challenges are different than weaknesses, because weaknesses are like, they're similar, but like when Helen just said lack of vision, like I think that's a weakness, lack of vision. We could strengthen our vision. We could be more creative, right? A challenge is something we probably just need to look at and overcome. Actually, now that I've said those two things, that actually doesn't differentiate either one of them. So I don't know, y'all. Let's just move into challenges so we can end with opportunities. That's all I'm trying to get at. So challenges.
I feel, this is Patrice. I don't know if I'm on challenges or stuck in the last topic, but I know for me, one thing, as I go through this, what do I want my life to mean thing, as I hit middle age, looking at like where I grew up and what can I do for the area that I grew up. And for me, I'm really sensitive to the zip codes 48209 and 48217, looking at, and especially in terms of how can we make a healthier Detroit for older adults, looking at environmental justice and resource inequities. And I know that directly impacts those two zip codes. So like 48217 is the most polluted zip code in the state of Michigan. And how can we expect older adults to have the same chances in those areas as we do other areas in the state of Michigan? For example, doing some research there, there's one block in Detroit, in that area, Ethel, the 1200 block of Ethel. Out of 13 houses, there are 11 older adults that I know of that died from cancer. Out of 13 houses. And they're surrounded by Marathon Oil, the salt company, and they don't necessarily have the same opportunity. I know in 4217, there's no grocery store in the area. And in those areas, 4217 is 80% African-American, 4209 is about 79, about 80% Hispanic. And we just have to figure out some way to provide, I don't know, more resources, advocate for those two areas, because I think they suffer, greatly with the challenges that was brought over to them historically. So I don't know if that's challenges or I'm just still talking about the last topic.
No, I think that is so powerful, Latrice, right? Because I'm also thinking what happens to, like when I hear environmental challenges, I hear those things like toxicity in the water tables and the air, which is leading to those disparate health outcomes. But then I also think about like, what happens, we know this, what happens when there are floods, right? Because Detroit has been actually had some serious floods. So there is a disparity in who gets assisted in those types of environmental catastrophes. Ana Rosa.
So tying back to what Mary Carmen was speaking about with education, I do think across the board literacy, we know that to be a challenge, and referring to our seniors at LACED, one of the challenges is if they may have limited English proficiency or none at all. So of course, they require a lot more assistance, and that combined with maybe just a few years of education. So even if a letter comes to them in Spanish, they can't understand it or read it. So I think that's another across the board issue or challenge, I would say, for our seniors.
Definitely. Well said, Ana Rosa. And I mean, that's, health literacy, financial literacy, it's across the board. And people get really disconnected from resources when they can't understand the application or the whatever it is.
Right, exactly.
Phil, could you repeat the last point, last thing that you just said? I had to cut out for a second. I needed to sign a couple things.
And you're muted.
Oh,
you're muted, Phil.
I know, but now you put me on the spot, Mary Carmen. My God, what did I say? I have no idea. Vanessa, what did I say?
I have no idea. I don't remember either.
I'm sure it was brilliant, Mary Carmen, but I'm sure
it was brilliant. I wanted to comment on it, and then something distracted me.
Are you talking about environmental justice and
resources? That was Ana Rosa.
Yeah. Maybe that was Satrice.
That was Satrice, yes. And then, so I was talking about the floods. I don't know if that.
Oh yeah, that's what it was. Excuse me. I'm so sorry. But yeah, environmental, Satrice, I'm right there because those are our zip codes that we serve is 209, 217, 210. And the environmental impact of this pollution and I don't know who the heck got it in their brain that a second bridge would be so great for this community because it's just going to bring more pollution, and it's ripped up our streets and caused untold pollution, digging up with all the digging and dirt that's laying around. The seniors have even more difficult time to get around. But the flooding, Phil, that was what I wanted to comment on is where the resources that LACED provided for our seniors, filling out the FEMA requests, and it seemed all for naught because the majority of seniors and the majority of applications that we helped the community with were turned down. And they just most of our people that we assisted take it at face value. They don't go the next step to appeal. And because they feel bad. Well, they said no. Well, you know what? Let me tell you, I personally know somebody that's appealed the FEMA decision 4 times. And they gave this person, they would give the person more money each time she appealed. So the key is to keep appealing, but people don't want to go through, once again, it's red tape. And the city is difficult enough to get through, right? And I have not, the city, as far as the flooding, working with the Great Lakes Water Authority or the Department of the Detroit Water Department is difficult. I don't know anyone that's received anything from those 2 organizations, but the red tape is difficult for the city. It's horrid for federal. So environmental impacts, once again, planning is the planning of the infrastructure for the city of Detroit is horrible. I mean, you see right now outside on Werner Avenue, tremendous amount of supposedly improvements for the water system and fiber optics and I don't know what else, but they don't give us notice. Ana Rosa will agree. They give us very little notice that you know what, we're shutting your gas off. We're shutting your gas off. Oh, maybe 3 hours, maybe less, maybe more. We have senior programs running. My seniors can't go without heat right now. Today they could, but when they shut it off, it was really cold. So we had to cancel our programs. What do you do with the lunches? How do you feed your seniors that were counting on that lunch today? So I don't know, Phil, I'm running off, but I loved your question pertaining to flooding and other environmental impacts that we have.
Well, and you just also made me think, because now if memory serves me, we had 2 back-to-back really devastating floods for Detroit, like one after another, one year, then the next year. Then we had COVID, it seems like. So now I'm thinking, what about all of that wet, nasty basements and houses that didn't get remediated, which is probably a lot of them? And how does that affect people being susceptible to COVID, right? Because there was mold and spores. And so it's a systemic thing that, you know, I don't think that we spend enough time thinking about environmental consequences, and because we're going to have to start thinking about them. Ana Rosa, did you have your hand up or did you just forget to take it down? I want to make sure everybody gets a chance to speak. You know, if you want to, Sheila, I know that you're typing. Oh, there's Melissa. Okay, thanks, Melissa. Melissa has to take off. Eddie, how are you doing?
Great.
Good.
Maybe we should move into opportunities.
Let's move into opportunities. Okay, what are our opportunities? Sudha, I loved hearing from you. It was super valuable what you said. Sophia, I know you're just sort of joining us as a, you know, fabulous medical student, but you have good stuff to put in here too, I bet.
One thing is someone said something about intergenerational opportunities. So I think that that's something that we may want to look at. And the whole issue around intentional communities, doing more planning around making sure that we have age-friendly communities with the purpose to upgrade the quality of life of older adults. I think those are opportunities.
Yeah, and Anne, I'm going to just I see your hand, Mary Carmen. I'm going to back you up, Anne, in saying I think a great opportunity for the city of Detroit is just its vastness. We have a tremendous amount of space, of actual state in the city. Go ahead. I see Mary Carmen, then Helen, then Ana Rosa.
I think that one of this whole conversation has been very enlightening and I think valuable. I think that one of the opportunities that it might bring to the table is that if we continue to work together and work with the city to strengthen our relationship with them, to strengthen their funding, because federal dollars are coming into the city. How can we work together to make sure that our communities receive the funding for programs that we know, because we're in the trenches, we know will make an impact to our specific communities, zip codes, etc. I loved this conversation. It was great. I think that it brings together a cross section of this city. And you know what? I didn't mean to be a negative Nelly today. It's just been, if the city of Detroit asked me to jump through one more hoop of fire to get this, to get this funding for improvements to my senior center, and everybody else at DAAA, I'm going to scream. Seriously, the hoops of fire have just been incredible. But I don't mean to be negative, because I love the city of Detroit. It's just, I was born and raised here. I might not live here anymore, but I work here every day. I spend more time here than I do with my family, right? With my husband, my poor husband. But I love this city, and these type of conversations it just enrich us as nonprofit support systems to the seniors and others residing in these sometimes overlooked communities. Thank you.
Right.
I think we have an opportunity to invite some other voices to the table. I think that Detroit has had the kind of attention over the years, and for a number of things, that people around the world pay attention to us. And there are planners in the world who just pull back all the blinders. And I think we need to seek them out and seek ways to be energized by some of the ideas that they might have. I remember years ago, with whatever the strategic planning process that was going on in the city, and I thought we should just invite the folks from Disney, because the people working at Disney properties can do anything, you know, with little trams for transportation that would zip zap around, you know, I mean, you name it. So it isn't that we would turn over anything to them, but to just bring really creative minds together to see what we're dealing with problematically and help come up with some solutions and some vision that maybe we really would put in place and maybe really implement over time.
Mhm.
Anna Rosa, I love that idea, Helen, by the way.
So this is more of like a broad comment, and maybe it would have tied more into our strengths, but I do think there is significant opportunity in the fact that we have communities and seniors that really trust us. And I feel like they are very committed to like in our case, coming to our senior center and being a part of it. And I just think that there is a lot of opportunity in having a population that really trusts us, and which, you know, we can, whatever we provide, they're very grateful for. So I love being a part of that.
That's great.
Winona.
Yeah, and I just want to piggyback on Anna Rosa. We have the opportunity to collect the needs and make those needs of our trusted community members known, and to help them know how to lift up their voice, because a lot of what gets attention is what's talked about. So if we can get more people to talk about what they need to the right people, then that'll help to create that buzz. So I'm glad that we're talking now with each other, as well as even cutting through red tape as well. So some of the things we've been working on with specifically mainly with our food businesses, is cutting through some of that red tape, like for our farmers and our food businesses, things that we find that people are a pain point. A lot of times the right people don't know that they're a pain point, and making sure that they know it and being very vocal about how it could be changed and finding why those issues are, Because a lot of times they have check marks that they need to check off, and they don't know. They're just going about their business, and they don't know that it is such a pain to us. The people that we're interacting with know, but they don't escalate it. So get into the right people who can who can fix our problems. So that's an opportunity.
Mhm.
So we have 11 minutes left. And what I want to do now is I want to shift focus again. And Vanessa, we're going to go down to those yellow sticky notes in the space group 1, it looks like. And the title is, what are ways we can solve the digital divide through community? So I don't want to make it too hardcore. Like I don't want to restrict anybody's thoughts about anything. Okay. But I would like us to think in statements like, we can do this. So let's have some statements like, we can do this. We are now problem solving. And the problems that we're solving are, how can we generate greater community, more vibrant community, more sustainable community through breaking through the digital divide? Okay, so anything about digital divide, community, I'm just going to put this out here. I just off the top of my head thought we should have an app that's specially designed for Detroit seniors, and it can be like a whole bunch of different things. You could play solitaire with one another, you could get coupons, and we would have some way that we would teach everybody to use it. It'd be fun, user-friendly. You could meet people all over the city. Okay, so maybe that's a cheesy idea. Maybe it's been done. Maybe it'll never happen. But those types of things. So let's get a couple down here so we can call it a day. And I would say, Vanessa, put my app idea down there, and we can pay for this whole thing once it gets developed.
In one of our committees, we talked about technology cafes.
Oh, yes, yes,
That
yes.
could sort of like pop up in different parts of the community, bringing together seniors, food, but also technology, so they can learn how to use it and that kind of thing. I'll just do that out as an example.
But that is it, right? That's community. It brings people together, and they're learning this skill about technology. I'm going to add on to that, Ann, and say maybe a technology and health fair. So it's like a combination with food trucks. Let's always have food trucks. So, you come and you can get your blood pressure. I don't know. You can do things that you do at a health fair, but you can also have some one-on-one time. I love that, with technology. And let's have a space where I'm going to teach you how to do a telehealth visit. We're going to do a telehealth visit right here, even though you're in real person time with me.
That made me think of kind of doing like a bingo, or like a kind of like if there was an event like that where it was like, okay, while we're here, we're going to use whatever device you have to do this and this, whatever it is, like let's refresh how to send an email or how to log into Zoom, and then having a little like bingo chart where it would be like, if you did whatever 5 things, you got whatever raffle prize, or just if that was one event. I like that.
Exactly. That's such a genius idea, right? Because people love to win prizes. People love that. I don't care what age you are, but people love to win prizes. That's a great idea, actually. It's a really good idea.
It'd be great to have expanded broadband so that people could access technology wherever they are, that's affordable or free.
Yeah, and honestly, I keep thinking this. We are going to have to face this reality that broadband is going to have to be provided just like consumers energy or DTE or our water, because it is almost required to live now, right? So it's going to have to be a utility that is regulated and affordable
And safe.
and safe.
And safe.
Well, yeah, I don't know if it, yeah. It should be safe, right? The water should be safe too, though. So don't get me started on that.
For sure.
I think that overt presence in the city planning process, like overt presence for senior needs, for the aging population, right? To sort of counter that narrative that Suda brought up, that we are all aging. You know, when we talk about disability rights, because I do some work in disability studies, you know, we often say at this moment, I'm fully abled, right? But at any point, I can become a person with a disability. And in fact, the longer I live, the greater my chances that I will become a person with a disability, right? And so to understand that the disability is not necessarily an other, like the aging is not necessarily an other. If we live long enough, we are all going to be aging and aged and hopefully by the grace old, right? And so to incorporate that into our view, and it's certainly our citywide view, if not greater than that. We have 4 minutes for any wonderful closing arguments.
I think we don't do a good enough job observing and learning from developing countries. That's one piece. I think there's a huge opportunity there because a lot of developing countries are engaging, are taking approaches and solutions and overcoming barriers in ways that would be applicable to us. So the global South, global North divide, I think we can, if we tapped into that, we could really benefit vulnerable communities. Take, for example, I know that there's several developing countries who skipped over the whole landline revolution and went straight to cell phones because they did not have the infrastructure to build landlines and wires, but they could develop their technology for cell phones faster. So that's one of the ways in which they kept up with the rest of the developed world. So we could learn from things like that.
Mm-hmm.
And interestingly, there are folks in our country who have gone to developing countries with some outstanding ideas that could have had a lot of application in our own country and could still have application in our own country. So keeping an eye out for those folks too, to help chime in.
Mm-hmm. Interesting concept for sure.
Oh, friends, this is so Anne and Krishara and I have gone through all 5 subcommittees and this is the first round. And this, I can tell you, has been, for me anyway, extraordinary. Extraordinary. What I've heard, what I've learned. I'm super excited to go these next steps and to see our project come into some beautiful fruition, and then to have DAAA lead it into its next step. I will be sending out, or I will be connecting you with some readings that you might do if you like. And then we'll reconvene at the first of the year to continue this conversation, perhaps a little more focused. So our evaluation team will be sort of focusing the ideas into a more streamlined discussion. So you can look forward to that. I hope that you all are anticipating at least a little bit of downtime toward the end and beginning of the year. And as always, reach out if you need me. I'm going to put my email address in the chat. And anything else?
No, if there are other people who you think should be at the table, consumers or other community stakeholders, just drop us an email and we'll engage them. Have a happy holiday and thank you for your engagement today.
Happy holidays, everyone.
Bye,
Take care,
everyone.
stay safe.
Hi, everyone.
Bye.
Thanks, Phil.
Bye, Anne. I
Vanessa.
adore you. Bye, Krishara. Have a good holiday, both of you. We'll see you in the new year, okay?
I feel, thank you. Bye, everybody.
Thanks, Anna Rosa.
Bye.
Bye.
Thank you, everybody. Bye.